The earliest known use of the word, according to the Oxford Dictionary, was in the 1820s, round about the time when Mike was born.
Well, hey, chicks dig 200-year-old guys, right?
I don't know about that.
But since time immemorial, it's something that every woman has had to go through.
That's right, and today's topic is all about menopause on Everybody Knows.
Hello, everyone, and welcome to the second season of Everybody Knows. My name is Mike Kasem.
And I'm Catherine Robert. You know what? Today's topic is super important for women. Now, the expert answering our questions is Dr. Jeanel Goh. Welcome to the show.
Hello, Dr. Jeanel.
Hello, hello.
Welcome to Everybody Knows. Nice to have you.
Oh, so great to have you. So, first question, how do you define menopause?
Well, menopause in a normal woman is actually refers to a state whereby she actually stops her period for 12 consecutive months. And this actually signifies that the ovaries have stopped functioning and it actually ends her end of her reproductive potential. Yeah, so basically the period leading before the menopause onset is actually what we call as perimenopausal period. And it can last as long as up to 10 years before the onset of menopause. In this period, the ovaries function start to decline and it affects the production of certain hormones like estrogen, progesterone, and testosterone, which leads to a variety of symptoms.
Right.
So after menopause is this period we call postmenopausal period. And this is sometimes the symptoms from the perimenopausal period can spill over into the postmenopausal period for even up to 4 to 5 years.
What would you say are the symptoms of going into menopause, which is that period of perimenopause, right?
Yeah, so they have a variety of symptoms, you know, like hot flashes, like muscle ache, fatigue, sleep issues. Some of them, they have bone issues as well. And like sometimes they feel that vaginal dryness as well as like frequency in the bathroom.
Being a woman is hard.
It is. Already as it is.
It is.
It's tough, and then going through menopause is even worse.
Yes.
Now, we'll discuss those stages in detail later, but first, let's welcome our celebrities.
She bills herself as an entrepreneur and speaker, but she's most well known as a comedian.
She's a Star Awards Best Actress winner, took home the Best Supporting Actress at the Asian Academy Creative Awards.
Let's welcome the irrepressible, amazing Irene Ang.
And the one and only Cynthia Koh. Hello! Wow, wow, wow.
We must go ahead and come in because old folks are.
Oh, I see. Is it okay, take a seat slowly? Irene and Cynthia, you know, can I ask you about menopause? I feel so bad asking this question.
Why?
You know,
Because sooner or later you will join us. Don't worry.
Okay, you will get there soon.
Yes.
Okay. I mean, you both hit menopause, right?
Yeah.
How did you know?
I mean,
How did you all know?
I'm guessing because you're here. I'm guessing, but
So rude.
I'm leaving.
I just want to know, at what age did it hit?
Did you get the perimenopause, the one before? No.
I don't have all the hot flushes and all that. And I used to always have only one acne or pimple each time I have menses.
Right.
Right? So during that period of time, I'm like, why am I consistently, but also still one. Like, one finish already, somewhere else grow one, you know. I get tired a lot. I didn't even know it ended until like, so it was during COVID. So after COVID, I was like, what happened? COVID cured my menstruation.
So roughly, if you want to reveal, at what age was that?
About 52, 53.
Cynthia, what about you?
Mine was quite obvious. My perimenopause was quite obvious. I had weight gains, hair was thinning, and you have hair loss. And then my face is kind of dry all the time. So then later on, it just came as in periodically your period gets shorter.
Right.
And then slowly at 50, it just came in and settled.
Is it nice not having it anymore?
Oh, lovely.
Oh, very convenient.
Right?
Especially when you have to travel.
The bloating is gone then, right?
Yeah. No.
No.
The bloating stays
Stays.
forever. Okay, so I love after menstruation, your stomach will flatten,
Yes.
right? This one is like
Perpetually, right?
perpetually there. So you don't get a chance to recycle your womb to let it like flatten. So that's the only thing I miss.
And so not everybody gets perimenopause.
Yeah, no. Although menopause affects all women, only 80 to 90% of women get perimenopausal symptoms.
Mine is post, okay? Is there such a thing as you only feel the symptoms at post-menopause?
Yes, perimenopausal symptoms can spill over to the postmenopausal phase.
Look at all this stuff here. My goodness. So does everybody get all of these?
Not everybody, because
everybody.
apparently Irene didn't, right?
Okay, now that I see these,
Mood swings.
the mood swing always already mood swing.
What about sleep disturbances?
Yes, that one.
Yes. I thought it was work because COVID was very stressful, right? Trying to manage the different businesses that I have.
Yeah.
And probably...
Fatigue?
Fatigue, yes. In between the day, I must lie down for 15, 20 minutes. So I thought it was because of COVID.
Actually, you know what scares me a little bit? Heart palpitations.
Yeah, no doubt.
I get that.
Really?
Okay, so you got a lot more of the symptoms than you thought.
Yes.
Now that you see them.
Yes, I always thought it's the cold sweat, the mood swings. And I always think like, mood swing is very normal for me. I have ADHD, you know.
I've got a question for doctor.
Yeah.
What is bone thinning?
Well, because estrogen actually helps to protect the bone. So in menopause, where the ovaries stop functioning, they actually have a loss of estrogen and it causes bone thinning. And this is what we commonly known as osteoporosis.
Okay.
I'm trying to, lift heavier weights now. And then one lady was on saying, especially for women, you can prevent bone loss until you're 80 if you really...
Yes.
Oh, really?
Yeah.
Yes. Apart from like weight-bearing kind of exercises, we also encourage patients to like have an active lifestyle because it also helps with their cardiovascular health. And also for the type of exercise, we want to promote those kind of like resistance training to help with like your bone health and muscle health and to prevent the muscle loss.
Yeah. You guys need to do that. I'm telling you.
Okay, I'll do that. I walk to tapao food, then I carry the food, like the chicha or something, or the chicken rice, and then as I walk home, I do this.
Oh, well, good for you. You're going to have strong bones.
Yeah.
Okay, we were talking about age. There's a whole range, right, of when menopause can happen. It happened for you at 52, for Cynthia?
About 50.
50? What is that range?
Well, in Singapore, the range is about 45 to 55. And the average age in Singapore is about 49 years old of menopause compared to a Caucasian population, about 51.
Besides your ovaries, like, stopping working, right?
Yeah.
Is that the only thing that changes when it comes to menopause?
The main job of the ovary is to produce female hormones like estrogen, progesterone, and it also balances out with like the testosterone levels in the body, right? So basically that's the main role, and the hormones itself have effect on multi-systems in the body, which is why it gives rise to a whole myriad of symptoms.
So does it affect your sexual desire?
Yes, it does. Vaginal dryness is one of the symptoms that people experience, women experience during perimenopausal. So it may affect, their feelings during intercourse, the comfort level and all that.
So basically, just for my own knowledge, there's no delaying it, is it?
Well, there are certain things you can do to promote like a longer reproductive lifespan.
Oh, like what?
Yeah, so certain things like, for example, in your lifestyle, actually some studies in Singapore actually recently showed that smoking actually affects women of Chinese descent, in which they actually make their ovaries more sensitive to the damage of smoking, and it therefore reduces their reproductive lifespan. So actually, it's actually
Would that mean you get menopause earlier?
Yeah.
I want to ask you, because there's this myth that if you get your menstruation late, like some of us like get it at 12, some get it at 15, is it that your menopause will be later?
They have actually published a research by the University of Queensland. They found that actually people who actually have early menses, we call early menarche, before age 11, they have a 30% increased risk of early menopause.
Which symptoms should a woman go see a doctor?
During my perimenopausal period, they actually experience a whole myriad of symptoms. But out of those that experience symptoms, 1/3 are particularly severe. It affects their quality of life. It impairs their day-to-day functions. And this will warrant further investigations like blood tests to rule out other medical issues. And if need be, we will actually start them on certain medications to help them tide through their symptoms.
I think hot flushes is the most common one, right?
Sweat.
Hot flushes are very, very common among women. Yeah, they call this like vasomotor symptoms during menopause. Yeah, and it does affect people's day-to-day, because it makes them very awkward. They're just sweating in an aircon room, and they feel very anxious and stressed as a result of that.
And that makes it worse.
Yeah, it makes it worse. Yeah.
Alrighty, when we come back, we're gonna talk a little bit more about menopause, and we're gonna find out all the nitty-gritty details. Don't go anywhere.
Welcome back to Everybody Knows, and it is all about menopause today. And coming up soon, we're going to be looking at treatments.
First, though, a story of a home baker and what she went through during her peri-menopause.
Hi, I'm Mavis. I'm 50, a mother of 2. I'm a home baker, and I just reached menopause this year. I start noticing when I was the age of 45. Most prominent symptom is irregular menses and hot flush plus cold sweat in the middle of the night, and that causes a sleep disturbance. I had mood swings, then anxiousness, and a little bit short-term memory. In fact, my daughter is the one who asked me, "Mommy, what happened to you? Why are you so quiet?" So that's where I share with her that Mommy is going through a menopausal stage. That was perimenopause. When I was at the age of 47, I actually experienced heavy bleeding. And the bleeding actually lasts for 2 weeks. I need to change my sanitary napkins every 2 hours. I usually have a normal menstrual cycle of 5 days, and this is like not norm. So listen to my body, I actually seek help from a gynae. She did a D&C procedure for me and realized, yeah, inside actually there's 2 polyps and 1 fibroid, and one of the polyps is actually embedded on the lining of my womb. I actually joined a support group, menopausal support group recommended by my younger sister. She had menopause earlier than me. I have lots of friends within the group, and we kind of share what symptom you have, or are you going through this phase. From there, I feel pretty relieved that, oh, okay, I'm normal, I'm not alone. To alleviate the symptoms, what I do is I go for nature walks, listen to my favorite music, essential oils, keep me grounded. Then sometimes I do strength training 2 times a week and take supplements. I actually followed my daughter to Dr. Jeanel's clinic to remove her mole. And Dr. Jeanel is kind enough to ask me whether do I want to do a face scan. So from the face scan, it actually came out that I have pigmentation, I have dark spots, I have melasma. So that concerns me big time. So that's where I decided to seek Dr. Jeanel's help. Dr. Jeanel recommended me laser, skin booster because of my dry skin to hydrate, and I do a PDL light therapy to rejuvenate the skin. I can see a significant change in my skin. My pores actually smaller. Pigmentation definitely fade 2 times down, very near to my skin tone now. Even my friends, they say, "Hey, what have you done to your face? Can you tell me more about it?" Now that I've reached menopause, they find that I'm calmer, no longer that perimenopause range, and less anxious. Definitely a significant milestone. I feel happy, no more pads. When I reflect back since the start of my menstruation, to womanhood, to pregnancy, motherhood, and now menopause, I think I've come a long way. If I were to go through perimenopause and menopause again, I would probably read up at a younger age to know what's coming rather than when I'm at the very spot, then, oh, I don't know what to do. Another thing is probably join a support group earlier. You're not alone. Every woman has to go through that stage, and we are there to help you.
Wow, you know what? I think I better start reading.
I think you should join our support group. The Cynthia and Irene support group.
All 3 of you hold hands there, right?
All 3 of us hold hands together. I never knew there's such a thing as a menopause support
I
group.
didn't know, I didn't know. I always do all my Googlings.
I was suffering all by myself.
The drama.
Yeah. No, but I think it's important now. Just now she mentioned something. I noticed my skin also, all this pigmentation, melasma, everything she has, I had.
Just now you said got no symptom, now all the symptoms.
I know, now there's like, kind of like a flood of symptoms.
Now when I know these are the symptoms, then
It makes sense.
I physically didn't feel anything, you know, except for, and I really credit it to the COVID period being more stressful. I couldn't sleep. So I did a lot of research online, but later on, when the menses completely stopped, then, I just had menopause during COVID.
You know, I think for many women, it's not just about the physical aspect of seeing drier skin or wrinkles. It's also an emotional thing. When they get treatment, they feel more confident about themselves. And I think it's a plus for your mental health as well.
Well, it's true. Menopause does really take a toll on women's appearance. And a lot of patients, when they come to the clinic and see me, they always say that I just felt like I aged so quickly within such a short period of time. And it really, how you look really affects how you feel, right? So not only they have skin changes, they also lose hair, they also gain weight, right? And particularly for the skin itself, the dry skin actually leads to like a decrease in the skin barrier and makes it more sensitive and very prone to infection as well. Apart from that, right, they actually lose collagen as well. And they also start to have more wrinkles forming on the face itself.
Collagen soup, does it work or not?
I think
Your steamboat one,
Nonsense.
Like,
Nonsense.
everyone's saying I'm like eating
good
extra
question, good
collagen
question.
soup, right? So
I also want to know.
We don't actually believe in eating like oral collagen supplements because sometimes, you know, the research show that it actually doesn't pass through the intestinal barrier to be absorbed because the molecules are quite big.
See?
How about those collagen masks? You say inside cannot, right? The outside, ma.
Yeah, I mean, for topical use of like collagen products, right? Only 10-20% of it get really absorbed into the skin.
That's not bad,
right?
though.
Yeah,
Yeah, it's better than nothing,
but it's not actually like really replenishing, but rather
not.
they help with like moisture.
So how?
We use certain types of skin boosters to help improve the collagen stimulation. We call biostimulators in the skin. Yeah, this is like what we call the concept of collagen banking in the skin because, you know, like every month when we get our pay, we bank some into our fixed deposit. So same thing, you know, during menopause, the collagen loss is up to 30%, right? So we don't want to wait until the collagen gets fully depleted before we start doing treatments to help with collagen supplementation and stimulating the collagen in the skin to grow.
Start
and
early.
of course, when the patient is 82, it's a bit too old, not much reserves, then probably that may not be the option to stimulate, but rather to just inject some other forms of volume replacement. Yeah.
So, Dr. Jeanel, for symptoms like hot flashes and mood swings, there's hormone replacement therapy. What exactly is it, and is it safe?
Well, so the crux in menopause, right, is that the ovaries stop functioning during the perimenopausal period. It starts to decline. So when the hormones actually decrease or there's hormonal imbalance, people believe that when they replace the hormones, it helps the patients to feel better, right? But it's not without its contraindications because not everybody is suitable for hormone replacement therapy, and we will actually advise them to see a doctor first. Yeah, this is something that we will check very thoroughly before we commence them on replacement therapy.
how about like alternative treatments? You know how they have those at the pharmacies, they sell it online for menopause.
All those supplements, and you know, we see a lot of advertisements on that on TikTok. Yes, but usually there's no really like validated studies to prove it. For menopause, the thing that people usually talk about is like black cohosh, right? It does probably provide some temporary relief, but there's not much of like validated studies to prove its efficacy.
I've got a question for the two of you.
Yes.
You know, in this menopause period, did you ever go to a TCM to, you know, sort of alleviate the symptoms or...
I did. I went to try TCM, but
What did they do?
apparently when you're menopause, you're adrenal fatigue. So your body is actually in stress mode.
Yeah.
So they'll give you something for your liver to alleviate and stuff like that. But because it's in powder form, and there is a time to take it, so a bit troublesome in it. So I started supplementing Primrose, whatever. So I started supplementing maybe mid-40s. So I don't really get a lot of the hot flushes and all that. It's just the hair thinning, skin dryness, and that's about it.
So supplements, is that key for someone who is in menopause?
Well, I mean, the supplements in this day and age, they don't have as much of evidence as compared to the hormone replacement therapy.
Right.
But sometimes it may provide some temporary relief. Yeah, but if they have some underlying liver problems, then we have to be careful. It has to be taken with caution as well, because we don't know how the body how the drug will interact.
Okay. You know what? When we come back, we're going to play a little bit of a game. That's where things get super competitive between Mike and I. That's going to be a whole lot of fun, so don't go anywhere.
Welcome back to Everybody Knows, and we have been having an excellent, in-depth discussion with our expert here, Dr. Jeanel, and our awesome celebrity guests, Cynthia and Irene.
Yeah, I don't know about, you know, Cynthia and Irene and how competitive they are, but I always try and beat Mike. Are you all competitive?
Easy.
Can.
Can, huh?
No problem.
All right, Dr. Jeanel, you are going to be asking the questions, and we have our true or false badges here.
Yep.
And we also have some pins here for the winners.
Oh,
okay, so
okay.
you just take like that.
Every
Just
time you
take
win, you
hand.
take one.
Like
Huh?
that, yeah.
Okay.
Yeah. All right, Game Master
Okay.
Jeanel.
Okay, so question 1. Menopause is diagnosed when a woman hasn't had a period for 12 months. Okay.
I'm going.
Yeah, everyone got correct.
Yay!
Oh, maybe we don't have enough pins after all.
Question 2. It is still possible to get pregnant when you are perimenopausal.
Ooh.
Oh, we have 2 true.
Okay, Cynthia and Catherine got it right.
How is that possible?
Because your period is still going on.
The keyword was perimenopausal.
Yes.
Perimenopausal.
Too much noise. I didn't hear the Perry.
Okay, so question 3. All women have hot flushes during perimenopause. Okay, so
Mike, you are asking to get beaten up, you know. What? All women.
the 3 women won.
Yay! Tick.
I have 3, yeah? Just in
too.
case anyone's wondering, I have 3.
Now, are you ready for question 4?
Yes.
So menopause can only start after the age of 40.
I don't even want to see this.
Everybody got it right.
Yeah! Because you know why? Everybody knows.
Question 5. In a study published by NUH and the Yonglulin School of Medicine in December 2023, the most common menopausal symptom reported by women was muscular and joint pain. True or false?
Muscular and joint pain.
Processing, loading,
Wow, this is hard. This is
loading.
hard.
We have a winner. Cynthia.
Did you guys all say false too as well?
I want to object.
Because I thought it would be like hot flashes or
Yeah.
something.
No,
Because
osteo
that's
is
not-
one of it. That's
but
very common.
Yeah, but then not pain what?
Yeah, so I mean in Caucasian population, it is true that the vasomotor symptoms like those hot flushes is more prominent. But in Singapore, the study conducted in Singapore actually showed that this study, the most common symptom was muscular.
You know why, Irene? We are Caucasian population.
I've just been proven that I'm actually a Caucasian.
All right, well, I guess we
Wow.
have an outright winner, and it is none other than Cynthia Goh.
Thank you.
I'll tell you what, guys,
How
this
many
has been
did Mike have?
2. That's it. Not very much.
checking, just-
Guys, this has been a fascinating discussion today. All thanks to our expert, Dr. Jeanel, who has a well of information. Yeah.
Indeed, indeed. And also a big thank you to our very fun celebrity guests, Irene Ang and Cynthia Goh.
Yes. Thank you, guys. We
Thank you
appreciate
guys for coming.
Yeah, being so open to discuss your personal situation. We appreciate you guys so much. Guys, we're going to sign off for this episode. Till next time, I'm Mike Kasem.
And I'm Catherine Robert, and thanks for joining us on Everybody Knows.